Joining me right now, Dr. Farid Saleh, and he's with the Ehrlich Animal Hospital and Arthritis Therapy Center. He's a veterinarian. Thank you so much, Doctor, for coming by.
Thank you for inviting me.
Okay, we're not going to get wonky on you folks, but we're going to talk about stem cells. And I know when you hear about stem cells, everybody thinks, you know, that are taken from babies' embryos and all that kind of stuff.
Right.
That's not it at all. So let's talk about a stem cell. What exactly is a stem cell?
A stem cell is a very premature cell in your body that has the ability to develop into many other cells.
And this comes from where in the body?
From fat. We collect it from fat, and that's the big misconception. Sometimes people think that we're collecting from other places, but it actually comes from the fat inside the abdomen of a dog. That's where we collect it from, and we extract the cells from that fat.
Now, stem cell, the technology has been around for a number of years, but you know, yours is the first time that I've actually heard it being used for pets.
It's been around for quite some time. We've been involved with it for over 6 years, and the technology became available, and the reports were very good, and we decided to offer it at our office.
So how do you harvest the stem cell?
So it's a very nice, simple thing, really. It's a one-day procedure. The pet comes in. It has to go under anesthesia for us to collect the fat from the abdomen. Mm-hmm. Then it takes about 4 hours to process the cells. And during that time, the pet wakes up and we recover them. They're kept comfortable. And after that, we give a short-acting sedative to inject the stem cells into the affected joints.
Now, when you say you extract them, you know, this is the crazy mind of mine. I'm going, oh my God, they open them up and pull them out. This is with needles, right?
Right. So we collect the fat, surgically remove the fat, and then it is processed. The fat is digested, and the stem cells are extracted. So when you collect, let's say, this much fat, we're only going to inject about 2 or 3 cc's of stem cells, so the amount of liquid that comes out of there with stem cells is a very small amount compared to the fat that's there.
Okay.
And so that's kind of how it works with the cells.
Okay, now, so then when you inject it back into an area, and let's talk about arthritis just in general for pets.
Right.
Is it more common among dogs or cats?
More common in dogs.
And what's the likelihood that every dog that's over a certain age will have arthritis? Is it?
It's very likely. The larger the breed, the higher the risk of them developing arthritis. And so an interesting thing that we've learned over the years is that if you bring a 12 or 13-year-old dog to us with arthritis who has had years of arthritis issues, the results are not going to be as good as if you do it in a dog who's 7 years of age, where the arthritis is just starting. So it's not this miracle treatment that can recover a 13-year-old dog and make him run around like before. So we would definitely recommend with certain breeds that are prone to arthritis, to look at them earlier in life and then maybe collect even the stem cells earlier in life, and you can actually bank the cells, meaning you can save them to be used later in life.
Now, so this process has been around. When we say arthritis, we're talking about primarily in the joints, correct?
Yes.
And again, I talk about the aging process. It's like when people get old. I mean, I know that my grandfather had arthritis really bad, but my grandmother didn't have it at all.
Correct. And so in dogs, it's mainly more, I think, an aging change, and it's definitely breed related. I mean, we see it in your medium to large breed dogs mainly, your Labradors, German Shepherds, Rottweilers, those type of breeds, very active sporting breeds that tend to develop that. So it's definitely a more common issue in large breed dogs.
For arthritis, a normal treatment, if you weren't using stem cells, what would it be?
Well, we offer a lot of different treatments for dogs. There are laser therapies that can be used, therapy lasers. There are anti-inflammatories. There are nutritional supplements, just like people take for arthritis. So those are all very nice things. I think that stem cell is probably one that would have the most effect in the long term, and also with the least amount of side effects, because we are collecting the cells from the pet itself.
So there's no rejection or anything like that?
Exactly. We're not treating them with a drug. We're basically using their own tissue to try and improve their quality of life.
Now, what happens with pet owners is, because I wish pets lived as long as we did, but they don't. You know, 10 to 15 years are wonderful, wonderful years when you have them. But then it always becomes a question, well, how much is this really expensive? And when I say really expensive, when I start hearing, when the vet tells me, we're going to brush your dog's teeth and it's only going to cost you $950.
Right.
Now, you know, I mean, this becomes a reality for people.
Correct. So stem cell is not for everyone. I think that it is definitely a very new technology in terms of offering it in a veterinary practice setting, but there isn't a lot involved with it. And it probably, it would range in the neighborhood of $2,000 to $3,000 to do stem cell therapy on your pet.
Now, is a one-time fix good, or do you have to do it real often?
We've done a few and repeated them, but it's only been 2 years. So it took 2 years for someone to call us and say, I think we need to repeat it.
Yeah.
And so for those clients who think that maybe they want to do it down the road, if they bank the cells and save them, the follow-up treatments are less expensive because you don't have to go through the whole anesthesia procedure to collect the cells again.
The storage of the cells, there's a charge for that
There's
too?
a fee for that, but it still is more reasonable
than having to do it twice. Yeah.
Do it twice.
Yeah, and the percentage of success that you have with this?
You know, it's interesting that with pets, and if people have certain treatments done, there's that psychological component. You don't know if they're thinking they're getting better. The nice thing with dogs is they're going to get better, and they'll show you that they're getting better. Right. For example, we had one that was treated that would not lift its leg to go to the bathroom. A male dog.
Yeah, yeah.
After stem cell therapy, he started lifting his leg again, which means that his hip felt comfortable enough to do that. So there's been a lot of good things that have come out of it. The most important thing I've learned is that you need to do it earlier. Because when we first started and we had a lot of clients asking for it and the dog was 12 or 13, the effects are not going to be as good.
Yeah. Ehrlich Animal Hospital. So somebody can come in and get an evaluation and just have a sit down with you and say, hey, this is what my dog needs. Can you help me out, right?
I've had a lot of phone calls, and just get on the phone and explain the process to them, and we can do that over the phone before they bring them in.
Right.
And I'll be happy to do that.
And can you just make a pill so our dogs and cats don't get old? Can you do that?
I know. I think we need to work on that for sure.
I know. We just love our animals so much. Dr. Saleh, thank you so much. Good information. Appreciate your time.
Thank you very much.